Welcome back, everybody. With the hot temperatures, it's pretty difficult right now to believe that we're talking about winter and flu shots. Is it too early to get a flu shot? Well, here with all the answers is Dr. Fred Nagel with Baptist Health Family Clinic in Maumelle. Dr. Nagel, great to see you this morning. Thanks for being here. It is kind of interesting that we're talking about flu shots. Is it too early to talk about flu shots at this point?
Well, as Courtney mentioned, they're going to be available very soon. And the flu season generally begins as early as October, can run as late as February. So my advice is to get it as early as you can, for the simple fact it takes at least 2 weeks to get immunized once you get vaccinated. And even if you get the flu shot early, you're really not going to need a second dose. One shot should carry you through the season. Yeah,
you don't want someone in your family to get it and then you get it, because like you said, if it takes a couple weeks, then you could contract it before it takes full effect.
Best to be prepared.
All right, so who should get the flu shot? And there has been, over the years, some studies done that some people it's better suited for than others, the shot itself.
Well, the short answer is just about everyone.
Just about.
Just about. There are some exceptions. But the thing that people should know is the more people that get vaccinated, the less chance of that virus spreading through the community, so everybody's a winner.
Yeah.
But the groups that should be targeted are pregnant women, those that are elderly or the very young and their caregivers, and those who have chronic illnesses like asthma, COPD, and diabetes. Now, that group that should avoid the flu shot, it's not recommended if you're an infant less than 6 months of age. That's because you get some passive immunity from your mother. And other people that shouldn't get it if you've had a previous allergic reaction to the flu vaccine or to eggs, or if you've had Guillain-Barré. And you probably should postpone at least getting the flu shot if you have fever or an illness at the time.
In past years, we've had the shot, of course, but also the nasal spray has kind of come on and been something pretty popular. And I know that is also pretty specific on who should get that and who shouldn't.
That's right. The nasal spray is called Flu Mist. It's given intranasally instead of a shot, so it's preferred by lots of the kids. It's actually approved only for ages 2 through 49.
Okay.
The CDC specifically recommends it for healthy children aged 2 to 8.
Wow.
So it's not for everybody.
Small sample size there.
That's right.
Yeah.
And then there's a standard flu shot for the rest of it, and there's even a high-dose flu vaccine that's been available recently, targeted for people over the age of 65.
Now, with all the communication about flus and the flu and the safety of it, of course, the results, a lot of people, I think, overlook this. We hear in the news all the time about bird flu and all the different strains, but really the common flu can be a killer, and that's why it's so important to bring this up and to talk about everyone needing to get something like this.
And we never know what kind of flu season it's going to be, but experience tells us to be prepared, because actually the last few years have been very active. In fact, the CDC has estimated that between 20 and 30,000 people in the United States alone die of the flu each year.
Wow.
So, and even in spite of that, we have people who either neglect or simply refuse to get the flu shot. And it's usually based on myths or some misinformation. And the most common thing I hear, or one of the most common things is people say, last time I got the flu shot, I got the flu.
I got the flu. That's what you hear all the time.
That's actually impossible, because there's no live flu virus in the vaccine, so you can't get sick from that. You either got sick from something else or had a mild reaction to the vaccine. The other thing I commonly hear is, I'm healthy and never had the flu, so why should I get it? Well, good for them, but their luck may be running out. They could get that illness, and why not be prepared? Why risk your health with a disease that could be deadly and prevented by a very simple, effective, and cheap vaccine?
So simple you can do it, and you can always get it at Baptist Health. Make sure you contact your local pediatrician. A lot of businesses offer it, stores offer it. It's basically offered everywhere these days, so take advantage of that. Here's the Baptist Helpline number, 1-888-BAPTIST. Dr. Nagel, thanks for coming in today. Appreciate it.
You're welcome.
All right, coming up